Hello, as you guys know, my name is Amy. I'm a nurse here at our urgent care clinic as well as in our education department. And this is my friend Brian. It looks like Brian is about to have his blood pressure taken, but as you can see, there are several things wrong with this picture. So we're going to spend the next few minutes talking about why we take blood pressures on our patients in the clinic, what happens if we take inaccurate blood pressures, as well as some quick and easy fixes to make sure that we get correct readings on our patients. So Jen, how many blood pressures do you think you took today?
About 30.
30? Okay, Cecilia, what about you?
About 35.
35? Okay. So we know that in a busy urgent care day, we can take anywhere between 30, 40, maybe more blood pressures than that. But it's also important for us to remember that blood pressures aren't taken just so we can put numbers on the chart so we can look busy. We take blood pressures on our patients because our providers make treatment plans based on the numbers that we come up with. So first of all, let's talk about why we take blood pressures in our clinics. So the U.S. Preventative Services Task Force helps to set the guidelines for the preventative screenings that we perform for our patients in the clinic. They currently advise that we take blood pressure on all adult patients over the age of 18. And I have a quick quote from them. High blood pressure is a prevalent condition affecting approximately 30% of the adult population. It is the most commonly diagnosed condition at outpatient office visits. So we also know that high blood pressure readings help us to identify our patients who may be at increased risk for cardiovascular disease, heart attack, stroke, kidney disease. And we know a lot of the population that's coming to see us at urgent care is in the group that's at risk for these problems. Some of the patients that we see are actively experiencing those problems when they check in to see us. So next, let's talk a little bit about what can happen if we take inappropriate blood pressure readings and report those to our providers. So we've got some information from the National Institute of Health, and they tell us that underestimating blood pressure by just 5 points would misdiagnose more than 20 million Americans with pre-hypertension when in fact they should be treated for high blood pressure. It's also been predicted that this could lead to a 25% increased chance of fatal strokes and heart attacks that could have been prevented. Now on the other side of the spectrum, overestimating blood pressure, again by just 5 points, could lead to the inappropriate treatment of false high blood pressure for almost 30 million Americans. So that's 30 million people that we as nurses are putting at risk for misdiagnosis, unnecessary cost of treatments that they didn't need, as well as potential adverse drug effects from medications that they never should have been prescribed to begin with. So let's take a closer look at Brian and let's talk about what's wrong here. So first of all, it looks like my friend Brian is having a hard time staying upright. So that means he's working all the muscles in his core and his back. So we know that when we have major muscle engagement like this, it's going to affect the blood pressure that we get for Brian. Also looks like his legs are crossed. So this is going to be restricting blood flow to Brian's lower extremities, and that's going to affect his blood pressure. His arms are just kind of dangling at his sides, which doesn't help us to get accurate readings either. Looks pretty clear that this cuff is the wrong size for Brian. It's not placed appropriately on his arm either. So GE is the company that supplies all the blood pressure equipment that we use in our clinics, and they have told us that the #1 problem with inaccurate blood pressures with their products is in fact user error. So that's something that we know we can fix. I also see that Brian's got some bulky clothing underneath his blood pressure cuff. So that means that the cuff is not going to be able to inflate the way that it should to get a good reading for Brian. His mouth is open, so I'm also assuming that he's trying to talk at us while we're trying to take his blood pressure. So let's next take a quick look at how these factors can affect the numbers that we get for Brian's blood pressure. So some of these things that we talked about with Brian are listed on this poster. So we can see that these factors might affect Brian's blood pressure by as little as 2 points, sometimes maybe in as much as 40 to 50 points. So this is significant when our physicians and providers are looking at a potential treatment plan for someone that's had an odd blood pressure reading. Now we can also see on our poster here that there's other things that are kind of out of our control, things that we can't necessarily change for Brian's blood pressure. I don't know if Brian just smoked or had a double latte before he checked in to see us. I can't do a whole lot at the moment about his pain or his anxiety, and I don't know if he's got a full bladder. But I definitely want to make sure that I change the things that I can to make sure we've got a good blood pressure reading for Brian. So that moves us right along to things that we can do to make sure that we get a correct or accurate reading for Brian the first go around. So first of all, we would prefer that Brian is sitting in a normal chair so that we know that we've got his back supported. We know that he'll be able to have his feet flat on the floor and uncrossed. We want to get his arm elevated to heart level. We want to make sure that there's no bulky clothing over the cuff. We also want to make sure that we've got the correctly sized cuff and placement for Brian. We also want him to be still and quiet while we take his blood pressure reading. So we know that all these changes can help us to get a better blood pressure reading, which we know is good for the safety and the health of our patient. So over the last few minutes, we have talked about why we take blood pressure on our patients, what can happen if we do it wrong, as well as some quick, easy fixes to make sure that we start off with a correct and accurate blood pressure every time. So I hope you guys take home the takeaway message that when we report inaccurate blood pressures on our patients, we have the potential to cause harm and unnecessary costs to our patients, but we can prevent that by doing things right the first time. Thank you for listening, and I hope you guys have a great night.
Thank you.